Hello, I am Dr. Ritesh Gupta. I am Senior Consultant and Additional Director at Fortis CDOC Center of Excellence for Diabetes, Metabolic Diseases and Endocrinology at New Delhi. Today I'll be talking about hypertension. Hypertension, as you know, is a very big clinical problem. More than 25% of Indians are affected with hypertension. And if you say the age group between 15 to 50 years, as many as 10 to 15% of those people are affected with hypertension. Now, hypertension increases the risk of several other chronic diseases like heart disease, stroke, and kidney failure. So it's very important that hypertension be treated, and much better is that it should be prevented as far as possible, which we can do by very common things. There are several risk factors for hypertension. Some of them are not under your control, but some of them we can do something about. So one important risk factor is age, but then age is bound to increase, so that we cannot do anything about. The other thing is family history. That is also a non-modifiable risk factor. If you have a family history of hypertension in your first degree relatives like parents or grandparents or siblings, there is an increased risk of hypertension. In that case, you should be more aware and take all the preventive actions so that you don't develop hypertension. The other important risk factor is obesity or overweight. A large proportion of population of the world, and especially developing countries like India, is turning obese, and that increases the risk of hypertension. So it's very important that we control obesity by lifestyle intervention, by diet, by exercise, so that we can control hypertension and prevent hypertension. One very important factor is salt intake. Increased salt intake increases the risk of hypertension. And it is seen that Indians have a very high salt intake. WHO recommends that daily average salt intake of an individual should not be more than 5 grams, while it is seen that in India it is often more than 10 grams. So we need to control salt intake if we want to prevent hypertension. And how we can do that? We can do that by avoiding table salt. Simple enough that you should avoid table salt. You should avoid foodstuffs which are very high in salt, like snacks like namkeen, bhujia, etc., like sauce, chutney, papad, etc. In case you want to have a snack, you should try for a healthy snack. Even the dry fruits or the like almonds and cashews, if you want to take, you should take unsalted ones. They are the ones which are going to be helpful for you. Another thing is low intake of fruits and vegetables. That also increases the risk of hypertension. If you want to reduce the risk, you should increase the consumption of fruits and vegetables because they contain a high amount of potassium, and that is beneficial in order to prevent hypertension. The other factor is smoking. Smoking is very prevalent, and smoking increases the risk of not just hypertension, but independently it increases the risk of heart disease, cancer, and so many other things. So in order for a healthy society and also to prevent hypertension, one should quit smoking, one should not start to smoke. The other factors are, of course, high cholesterol, diabetes, which is very big problem in our country today. We are supposed to be the diabetes capital of the world, and diabetes also increases the risk of hypertension. It is often seen that diabetes and hypertension go hand in hand. So a person who has diabetes also subsequently develops hypertension. So it's very important that we prevent diabetes and manage diabetes well in order to prevent hypertension. But the most important factor would be to control salt intake, as we said earlier, that if we can reduce salt intake, if we can minimize salt intake, we can prevent hypertension to a very great degree. To prevent hypertension, one needs to control salt intake and increase the intake of potassium. So controlling salt intake is very important. You should avoid added salt. Whatever is there in cooked food you can take, but choose your food very carefully. Do not eat foodstuffs which are very high in salt. Avoid canned food. Avoid canned food and foods which are preserved because they have a very high amount of hidden salt. So that is something which is very important. You can take unsalted snacks which are much healthier than the salted snacks. Also, the intake of fruits and vegetables has to be increased, especially fresh fruits, especially citrus fruits. All those are very high in potassium, and they reduce the risk of hypertension. They are also helpful in managing hypertension to some extent. Also, one needs to reduce calories. So if you want to reduce weight, you have to reduce calories, which means reduce the consumption of fat and carbohydrate. Reduce, it's not eliminating completely, but reduction. It is often seen that Indian diet is especially very rich in carbohydrate and fat. Up to more than about 60 to 70% of calories in Indian diet are being provided for by carbohydrates, and consequently the amount of protein is very low. So if we want to have a healthy diet, we should increase the amount of protein and reduce the amount of carbohydrates and fats. You should increase protein, meaning that you should take more of milk products, of pulses like dal. You should, if you are a non-vegetarian, you can take chicken, fish, lean meat and egg. All these things will increase protein, and you should reduce the consumption of carbohydrates like roti and rice. Of course, you need them, you should eat them, but you should eat them in limited proportion. In that way, you will be reducing your calories, you will be providing a high protein diet, and your risk of obesity will come down, which would go a long way in controlling hypertension in the society. Thank you.